it's a huge gap in everything that's happened over the last year and a half is the real lack of coordination and communication. The Office of the Seniors Advocate has been left out of decision-making, and Dr. Henry has not really reached out very frequently to the long-term care sector.
Residents in long-term care can expect to receive a third dose of COVID-19 vaccine as early as today. But for those responsible for this rollout, they say a number of questions are still on the table.
All that we know is that it will happen in concert with the fall vaccine for the flu, and that's a high-dose flu vaccine that we use in long-term care. We don't know if it's going to be health authority nurses coming in to do the vaccine or if it will be pharmacists.
At least one long-term care center in East Vancouver says it's been preparing for weeks to hand out a third dose as soon as it can.
Typically, it's been officials from Vancouver Coastal Health, nurses that come in, whether they do that this time or not. We certainly have the capability on site of our team to do it, but we really just follow their lead.
But as both Lake and Hereford point out, having clear mandates would make things easier for all care homes.
How imperative is it for you to see your father get a third dose of COVID vaccine?
Well, I think it's imperative for him and for the others, but I think it's also imperative for us to ensure that all of the staff and volunteers are, at least receive their vaccines as well. Because I know just a couple of weeks ago, some of the staff were still getting their vaccines, their second shot.
Ruby Campbell says the onus can't just be on residents.
Not just for the safety of my father, the safety of the staff, but also my mother who's elderly and she visits daily. She's an emergency caregiver. So now we have other people that are going into the care home, assuming that the staff are vaccinated. And if they're not, we're also putting other people at risk.
Some places are already checking visitors' vaccine passports, and Hereford says third doses could be coming for another group involved in long-term care.
If there are staff who work in these congregate living settings who are right up close and personal with these seniors who are still vulnerable, we still see breakthrough cases. I don't know if that'll be the case with the booster, but I think the one area that I think we should be having more of a conversation about is the people who are at the bedside of the seniors and their waning immunity as well.
Health Minister Adrian Dix plans to provide more details about the rollout tomorrow. In New Westminster, Ria Renouf, City News.